Enterovirus 68 is a relatively new enterovirus. We actually had it probably back in the 1960s, but we haven't seen it again until this year. And it's a viral infection that generally presents as a respiratory infection and then progresses from there to get more serious from time to time.
And how, if someone comes in with maybe those symptoms, how do you decide, okay, this is respiratory or this might go up into this enterovirus 68?
Yeah, we don't always, have a good way of deciding that. The test that we use that checks between enterovirus and rhinovirus, which is the cause of the common cold, is actually pretty much a similar test. And so when it comes back, it says rhinovirus/enterovirus. And so we're sending specimens off to the state and the CDC for more specific identification in those cases that are the more sicker patients who are often arriving and needing vigorous respiratory support, either oxygen or ventilation, landing in our intensive care, that kind of thing.
Why are we seeing this now?
Yeah, well, periodically we do see new viruses. All you have to do is look at the swine flu. We had it in 1918, 1919, maybe again in the 30s, and then as recently as 2009, it resurfaced. And that's kind of how viruses are. Every once in a while you'll get a new strain that comes along that people are not resistant to it, and it makes a gain in the market. So it's not unheard of or unusual for us to have this happen.
Okay. Go into a little bit more depth. You talked it was respiratory, but exactly what are these symptoms? What?
It really just starts off with kind of a runny nose, a scratchy throat, fever, develops into coughing and more respiratory component. There have been cases that have progressed with neurological complications, and of course, most recently that unfortunate 4-year-old boy in New Jersey who died of Enterovirus 68. So it's unusual to have that, but certainly unfortunate.
And I think we've heard in the news there's maybe a paralysis component.
Yeah, there is a paralysis component of it also. Enterovirus is the family that poliovirus is in too. And we typically see enterovirus this time of the year. The most classic thing parents would be familiar with is hand-foot-mouth disease, which we see every year. In fact, this year was a bad year for hand-foot-mouth. But back in the 40s and 50s, this would be the time you would see polio cases. And the local swimming pool would be shut down and people would stay in their houses and, so you didn't come in contact with polio. Fortunately, of course, we developed a vaccine and polio is all but eliminated from the world. But the family of enteroviruses is still with us, and we still see enteroviruses on a regular basis. Now, as the weather gets cold, enteroviruses, migrate to warmer weather. And so we're just about over with the enteroviral season, and so hopefully it'll bring an end to, all this misery that we've had over the last month or two.
Who is most prone to this?
The people, well, anybody's prone to it. It seems like young children are always the target, but the people who seem to get it more seriously are people with underlying respiratory illnesses, most notably asthma. But children who might be on oxygen because they have respiratory problems, cystic fibrosis, or some chronic lung diseases, those seem to be more affected than the normal child.
How about here at Geisinger? Have you seen any of this come through?
We think we have, but again, we've sent specimens off to the state and the CDC, and we're waiting for tests to come back. We're calling them, and they're telling us they're terribly backlogged and they can't get all the work done. Since this is now pretty much a nationwide epidemic, and I'm sure many people are sending them specimens, we're not getting any results back yet from the state. So we don't really know if we've had an official case here or not. We keep waiting for identification, but so far we haven't been able to either confirm or deny any cases. We're just not getting any results yet.
What is the treatment for this?
Yeah, there is no treatment. There's no specific antiviral agents. It's supportive care. And so it's oxygen, it's respiratory treatments, it's IV fluids. It's just maintaining them in good condition and supportive condition, which is the most important thing you can do.
What is it? What's the prevention? Is it typical cold prevention? Or?
Yeah, it's typical. It's spread by contact, so it's hand to mouth. So good hand washing, cleaning surfaces carefully. People who absolutely don't want to risk this, stay in your house and lock the doors and come out, once the weather starts freezing, and you'll probably be okay. Of course, then you'll be dealing with influenza and RSV and other things. So there's always a virus out there.
when people start to use, and I guess it's the media's fault as well, we start to use this word epidemic, then people are all up in arms and get kind of nervous about it. Should parents be nervous? Is this something that's completely different?
It is completely different, and parents are nervous. You know, we're getting 5 or 10 phone calls every day on parents, and not just parents, but doctors who are concerned that their patient might have this, and they're sending us patients, you know, to evaluate for this. And so we are seeing an increase in referrals. We've had increased admissions, you know, as a result of this increase in cases that we're seeing. And so parents should be concerned. But it's a little bit relative. It's kind of a new thing, as you mentioned. The news media does jump all over, you know, these kind of things when you have them. You know, in another 3 months, we'll be inundated with influenza. We'll have far more cases of influenza. We'll have far more cases of complications and death from influenza. It won't get reported. You know, it's yesterday's newspaper.
So the deaths that do occur from this enterovirus are nothing skyrocketing. Just it could happen with influenza. It could happen with.
Sure. And again, as far as I know, nationwide, we've only had 1 death from Enterovirus 68. But we will have thousands of deaths this year due to influenza in this country. Many in the very young and the very old.
Okay. Well, give us again just some prevention tips, especially as we go into the winter season. What should people do?
Yeah. Well, again, careful hand washing. Mm-hmm. Get your vaccines. You know, the influenza vaccine is a very effective vaccine to prevent the flu. Enterovirus will probably be over this month. We'll probably see the end of enterovirus, at least we hope so. And we'll be moving on to another viral season. There's always a virus every season. So we hope that we don't have any more complications or any more disasters from Enterovirus 68.
And speaking on vaccines, would there be maybe one created for this if this was going to come around next season?
Yeah, if this gets to be, you know, a major epidemic or a major deal like, you know, you can imagine with polio or something like that happening, you know, we are capable of creating a vaccine for this. Certainly there's no vaccine at this point. There's no treatment for this other than supportive care. But we would be capable of developing a vaccine if this became, you know, a yearly thing and we started seeing more deaths and more paralysis to this. It would become cost effective to develop a vaccine for this. But, you know, again, it's like a lot of viral things. It may disappear after this year and we may not see it again for another 50 years.